We're in trouble in this country, and we're going to be in more trouble pretty soon because we have such a looming shortage of primary care physicians. We're kind of oversupplied with specialists and subspecialists and undersupplied with family doctors and internists and pediatricians and all of the basic elements of primary care.
We need physicians more than ever, and we need physicians who understand the people that they're going to be providing care to.
It's very clear. When you can increase access to primary care for young children and for families who are struggling to make ends meet, and they go early for care for a $50 doctor appointment versus a $500 emergency room visit, that's a big deal.
And when you go to underserved communities, the resources are obviously more scarce as opposed to other communities.
There aren't enough physicians in these areas as well as actual healthcare facilities to serve the population.
The best estimates are that by 6 years from now we're going to be short roughly 40,000 primary care doctors.
My clinic, the Almani facility, for every 10,000 people in the population, there was one physician.
When National Medical Fellowships was founded in 1946, the need for increasing diversity in healthcare was great. Now, with increasing numbers of people having access to healthcare and an increasing diversity of our population, the need for National Medical Fellowships is even greater.
We have provided scholarship support to about 30,000 students, and the amount of support has been over $40 million.
The GE Foundation Developing Health Program is really focused on improving access to primary care in underserved communities in the United States. The objectives of this grant are quite simple. It's to provide the opportunity for the medical students to spend quality time in low-resource communities delivering primary care.
General support is critical to narrowing the gap for our students to be able to afford to finish medical school. Our average student's income for the family is $35,000, and average medical school debt is $156,000.
NMF uses its resources to provide financial support to physicians when they're in medical school and to other healthcare practitioners who are studying to enter the healthcare system.
When I was a medical student, there were a lot of people who wanted to do this, but because of the cost and the differences in the actual salaries of primary care docs versus specialty, they chose to go other ways because of their needs. This is an opportunity for those folks who want to serve the underserved to be influenced to do so.
Healthcare is best delivered by physicians who understand the communities that they serve and are sensitive to the cultural, racial characteristics of those communities.
You're given two career paths. Do you want to be in academia, or are you going to go out into the private sector? We do not learn about the community healthcare systems, and by providing this program, it gives students the opportunity to experience firsthand how healthcare is administered to people within the community.
Part of NMF's mission is to develop a pipeline of culturally sensitive and linguistic appropriate students who can be future health providers and future health leaders. National Medical Fellowships has a number of service learning programs in different settings. Settings range from local hospitals in the United States to district hospitals in Africa, where there's one doctor for 100,000 people.
The goal of National Medical Fellowships is to help improve the health care of all Americans, and we do it principally through trying to make sure that we have sufficient numbers of physicians who identify culturally with the populations that they serve.
It's definitely influenced me to stay in the community and to continue my career in the community.
I frequently say that National Medical Fellowships work is so important that if it didn't already exist, we'd have to invent it.